Am I audible to all of you? Anybody? Hello. Thank you. Now it's time. Should I start now? Gayatri,
Yes, sir.
am I audible to you?
Yes, sir.
Now it's time that we start the paper, discussing the paper. And the paper assigned to me is MPCE-12, Psychodiagnostics. MPCE-12, Psychodiagnostics. And today it's the first block, and it is Introduction to Psychodiagnostics. Anybody, to all of you, Sonali, am I audible to you? Uh, Is it okay? Sadia, now I hope I am audible to you, all of you. If anybody is in any difficulty, see or he can report. Now, the first thing that we have to discuss about is the introduction to psychodiagnostics. Unit 1, Introduction to Psychodiagnostics, Definition and Concept, and Definition, Concept and Description. I have shared it in your screen. I hope all of you see. Gayatri,
Yes, sir.
do you see whatever I have shared in the screen?
Sir.
I have made this screen sharing. The topic that I am covered to is in your on your screen. Do you see that?
Yes, sir. Yes, sir.
Ah, then it's okay. Now, Introduction to Psychodiagnostics definition. Let me first check out the course, and then I will be discussing about the kind of things that you are supposed to know. You know, this is kind of class where you are supposed to have already gone through the paper and you have some doubt kind of thing, clarification, those kind of things. But anyway, I will be covering the major kind of things in this class. Introduction to psychodiagnostics, definition, concept. Then in the unit 2, you have methods of behavioral assessment. Unit 3, you have assessment in clinical psychology. And in unit 4, you have ethical issues in assessment. These are the kind of 4 units in this block. This is the block 1 today, and these are the 4 units. Now, there are some ideas about what is unit 1, what is unit 2, and like that. Now, introduction to psychodynamics. Psychodynamics means the different kinds or aspects of mental issues which are studied and measured and reported for different issues and purposes. That is the idea about what is psychodynamics. And in the introduction, it's like this: intelligence test, personality test, behavioral assessment, and clinical interviews all yield potential important information about the person being tested. But none of these techniques provide an overall assessment of the examiner's level of functioning. Psychodynamics means different kinds of skills, abilities, and other kinds of behavioral and mental skills, which help us to know details about any person as relevant to his functioning of life, healthy functioning in life. That is kind of thing. And intelligence objectives of this, let me tell you all, after completion of this unit, you will be able to explain the definition and concept of psychodynamics, discuss the various domains of psychological assessment, explain the 10 data sources for psychological assessment, and describe the practical applications of psychodiagnostic assessment. Now, psychodiagnostics. Korchin and Skolsbach, 1981. Just I'm going through the details of the kind of thing. Define psychodiagnostic as a process. One, what is psychodiagnostics first? Whenever I will not be intelligible or audible or any kind of problem, you can pass on information to me. Now, as a process that uses number of procedures intended to tap various areas of psychological functions, both at conscious and unconscious level. That means we are operating at least at the two levels. Conscious level, we have some mental kind of happenings and operations. At unconscious level, we have also some mental kinds of happenings and operations. And we have, relating to that, we have different mental functions, which you can call psychological functions. And psychodynamics is that part of psychology which studies these, how to understand and explain, measure these kind of things in a person for any further use. That is the kind of thing. Unconscious level, using projective techniques as well as more objective and standardized techniques. Now, psychodynamics is one of measurement and reporting is one of the major tasks of study of psychodynamics. How to measure different kinds of mental skills and abilities, how to report them, and how to use them for any other kind of required purpose. Measurement and utility of those kind of mental issues, mental skills, mental functions for other kinds of purpose. Now, using projective tests. Now, whenever we are supposed to make use of psychodynamics for measurement of any kind of individual psychological functions, then there are two different groups of tests. At least we can say one is a kind of projective technique and others are more objective and standardized techniques. Projective techniques are part of psychological assessment and measurement, where we try to measure the unconscious part of the person through some disguised or unstructured kind of stimulus. in those kind of, we call it projective because the material that is to be presented to the client is not meaningfully clear as it appears to be externally. And the observer projects himself. It is supposed that the observer projects himself or herself into the stimulus and finds some meaning out of that. And which we think that it is his unconscious reflection of his or her unconscious. That is, we will be discussing about projective types of techniques. And then other direct techniques are there, which we can call objective and standardized test. These are at least two kinds of, or we can call them as psychometric tests. These are at least two kinds of approaches for measurement. And in both cases, interpretation may rest on symbolic signs as well as scurable responses. Now, when it comes to measurement, we can use these two kinds of tests, but when it comes to interpretation, they're also different. For interpretation of projective kinds of tests is not same as interpretation of psychometric tests or objective kinds of tests or scoreable tests, tests having scores. That those things we will be discussing. Only the thing that you will be knowing these things by learning this block or unit of psychodynamics. Now, I will be covering only the important aspects of thing because one block needs to be covered in one class. Now, I told you about the objectives. The objectives are like this: mental psychological functions, understanding the psychological functions and their measurement process, and understanding the kinds of measurement as projective or direct standardized measurements or psychometric measurement, and with the goal of describing individual in personological rather than normative terms. And now, how to help, how with the help of those kind of scores from a person or those kind of reports from a person, we can understand or explain a person's psychological state of affairs. That is what is the kind of thing. And now, testing, assessment, and clinical practice. The most widely used clinical test can be divided into three types. Now we come to say that although we can use these tests for other kinds of purposes, but for psychodiagnostics, the purpose is largely clinical. When we find somebody in difficulty about the mental issues and problems or health, then we can use those tests for the diagnostic purposes. And therefore, the paper has the basic intention of understanding a person from diagnostic point of view when someone is in a clinical state. Do you get my point? Is it okay to go all about English or should I also punch with Odia also? ଆମର ଏ ସାଇକୋଡାଇଗ୍ନୋଷ୍ଟିକ୍ସ ର କାମ ହେଲା ଟେଷ୍ଟ ୟୁଜ କରିକିରି ବିଭିନ୍ନ ପ୍ରକାରର ସାଇକୋଲୋଜିକାଲ ଟେଷ୍ଟ ପ୍ରୋଜେକ୍ଟିଭ ଟେଷ୍ଟ ହଉ ବା ସାଇକୋମେଟ୍ରିକ ଟେଷ୍ଟ ହଉ ତାକୁ ୟୁଜ କରିକିରି ଆମେ କେମିତି କ୍ଲିନିକାଲ ଡାଇଗ୍ନୋସିସ୍ କରିବା ପାଇଁ ଜାଣିବୁ particularly for clinical diagnosis any kind of issues mental health issues. Now divided into three types. First of all, let us know what are the kinds of things. One, individual test for general mental ability. Any person is not same as with another person. ଜଣେ ଲୋକ ଆଉ ଜଣେ ଲୋକ ସମାନ ନୁହନ୍ତି. ସେମାନଙ୍କ ଭିତରେ there are individual differences with respect to many things, including intelligence, personality, motivation, life skills. All those kinds of things are different with people. ଲୋକଙ୍କ ଭିତରେ ପ୍ରଭେଦ ରହିଛି. ପ୍ରତିଟି ଲୋକ ଅନ୍ୟ ଲୋକଠୁ ଅଲଗା. And that constitutes the mental ability of a person. There are certain things which we can call general mental ability. And general mental ability, like personality, empowerment, like intelligence, like whatever. ତେଣୁ ଆମକୁ ପ୍ରଥମେ general mental ability ଗୋଟେ ଟାଇପର ଜିନିଷ ଯାହାକୁ ଆମେ first whenever we are meeting any client, we are supposed to understand about his general mental ability, basic things, basic mental skills, whether those are available with him or not, or is there any kind of deficit in some kind of general mental ability. Now, the two personality tests. Now, three types. One is general mental ability, and the other one is the personality test. Personality, as we understood in prior classes about psychology, personality is a source of basic and fundamental variations among people. People differ with regard to personality. Not only they have different personality, but personality as a source contribute to many aspects of one's mental ability. ଦି ଜଣଙ୍କ ଭିତରେ ପର୍ସନାଲିଟିର ଡିଫରେନ୍ସ, ଦି ଜଣ ପୁରା ଅଲଗା ଲୋକ ହେବେ ନୁହଁ ଖାଲି ସେତିକି, ଦି ଜଣଙ୍କର ସାମର୍ଥ୍ୟ ମଧ୍ୟ ଅଲଗା ରହିବ. They will be different. That is what is personality. And personality tests can give us several indications about mental ability and mental health, clinical status, clinical thing. Lot of things can be also understood from personality. And then neurological tests. Now, another important aspect of, particularly whenever we think of our mental functioning, our bioneurological characteristics or functioning is also more important. And recently, research literature have clearly suggested that a lot of mental health issues have come through our neurological dysfunctions. Neurological dysfunctions have created a lot of other kinds of things. Now, therefore, whenever we are interested in any kind of clinical investigation, these are the three basic and fundamental measurements or assessments that we are supposed to take up. ଆମେ କିଛି assessment, fundamental assessment ନବାର ନିହାତି ଆବଶ୍ୟକତା ଅଛି. Now, is it I am audible to all of you? And second thing,
Yes, sir.
Yes, sir.
Yes, sir.
audible. And whatever I say, is it clear to all of you?
Yes, sir.
Yes, sir.
That is my point of view. And then now, here we have discussed three types of assessment. The most widely used clinical tests, three types. Now, variable domains of psychological assessment. Bartaman, when we think of measuring these kind of things, supposing we are interested to measure someone's personality, we have to find out some kind of behavioral aspects where we can have the access to one's personality. ଜଣଙ୍କର personality ବିଷୟରେ କିଛି measure କରିବାକୁ ହେଲେ କୋଉ ବାଟରେ ଆମେ ଯିବୁ, କୋଉ ମାନେ processରେ ଆମେ measure କରିବୁ. And those are some of the psychological variables which will help us to measure different aspects personality. What are those psychological variables? କୋଉ variable କୁ ଆମେ measure କଲେ we can make some assessment about the personality of the person. One, performance variables. And we know that when two persons are different with respect to their personality, they will also have certain kinds of differences in performance. In some fields, in some areas, they will have some kind of differences in their performance. ଯଦି personality ଦି ଜଣଙ୍କର ଅଲଗା, କୌଣସି ନା କୌଣସି performance ରେ ସେମାନଙ୍କ ଭିତରେ difference ନିଶ୍ଚୟ ଆସିବ. ଲାଇନ ପଳେଇଲା, ତେଣୁ ମେ ବି ମାନେ ଇଏ ହେଇପାରେ, ଦେଖିବା କଣ ହଉଛି. Anyway, personality difference ଆସିପାରେ. କଣ ହେଲା, ଲାଇନଟା ପଳେଇଲା. ହଉ ତାହେଲେ ମୁଁ ଟିକେ କଭର କରି ଯାଉଛି. performance variables ଆମେ measure କରିପାରିବୁ. personality variables ଆମେ measure କରିପାରିବୁ by kind of things. Then data sources for psychological assessment. ମୁଁ ଗଡି ଯାଉଛି, ତମମାନେ ତାପରେ ମତେ ପ୍ରଶ୍ନ, ଲାଇନଟା ପଳେଇ ଆସିଲା. Data sources for psychological assessment. ସବୁ ଜିନିଷଟା ମୁଁ କହି ଯାଉଛି, ଯୋଉଠି ତମର ଟିକେ କିଛି ଡାଉଟ ଆସିବ, you can ask me. actuarial and biographical data. Biographical data means things relating to your biographical report, supposing age, gender, place of living, educational qualification, all those kind of things. Those are also a necessary part of any kind of investigation, because same psychological fact is not true about a woman what is true about a man. That is why all these kinds of things are also collected, and those are also relevant data. And actuarial data means whatever is measured about you. And behavioral data, these are the kinds of things that we usually measure. And behavior observations, ଯୋଉଠି କିଛି ମାନେ ବୁଝିବାର ଅସୁବିଧା ହବ ମତେ ଖାଲି ପଚାରିଦବ। ମୁଁ ସପୋଜ କରିବି ଯେ ତମେ ଆଗରୁ ପଢିଛ, ମୁଁ ଖାଲି ଟିକେ ଏକ୍ସପ୍ଲେନ କରି କରି ପଢଉଛି। then behavior rating, then expressive behavior. Expressive behavior means how you talk, how you walk, how you express your feelings, how you express your emotions. Those are also sources of data. And then projective techniques. I have already told you there are certain methods of measurement which we call projective, where there are certain practicals in your syllabus, and I am supposed to also teach two of them. Projective technique is TAT, thematic apperception test. Rorschach blood test. In Rorschach blood test, you will just find some ambiguous pictures, and you will give your response to that pictures. And the psychologist or the psychodiagnostic person will have to interpret them. So, tomato story interpret karibo, so that your unconscious, as revealed in your projective report, will be understood by that. Then projective techniques. These are some of the kinds of things. These are how to measure projective techniques. Questionnaire method. Most of you are acquainted with these kind of things. There are questionnaires. जो questionnaire प्रत्येक question की the subject or the respondent is like to give a response. एवढा सब तमरो practice बा practical kind of things रे कराबो, जो internship project जो मन करूथो उसमें they must be knowing how questionnaires also can be used. There are various kinds of questionnaire. For example, clinical personality questionnaire like Minnesota Multiphasic Personality Inventory, MMPI. There are questionnaires for different tests. It's not only for clinical measurement. There are for other measurements. Questionnaires are also there. But questionnaire is nowadays one of the most popular approach in measuring. हमें projective test कले हम जति की सहजन हुए ता सुविधा हुए ता जति की accessible हुए project questionnaire use करिके हमें अनेक जगह रे we get good findings and good report. तेणु बहुत प्रकार क्वेश्चनर अच्छी क्वेश्चनर यूज कराउछि. Now objective tests, मु वर्तमान कहूछि different methods of assessment: projective, questionnaire, objective. And objective tests, objective test means any kind of thing where the subject will get some kind of option. You give some statement and then followed by some options, and the subject needs to choose one option. It may be applied for any kind of examination and performance purpose. It can also be applied for any kind of clinical purpose. But the test has to be developed like that. Objective test. Psychophysiological data. And psychophysiological data, there are number of experimental things, number of things where psychophysics is important. For example, we know that one of the psychophysical measurement is about RL, raised limit or absolute limit. Means how quickly and efficiently you respond to a stimulus. तुमको एक दिन से देखे जाला परे तमे केते शीघ्र केते ताको सहजरे ग्रहण करितो, बुझी पारुचो, जानि पारुचो, internalize करि पारुचो. Those are all kinds of things. Those data are also sometimes, supposing someone is very late in responding to a kind of stimulus, किंबा कोनोसी कम जिंस हेले से जानि पारनी ताको गोटे बड़ पार्टी न कहले से सुनि पारुनी, किंबा whatever. Those are some kind of things which psychophysiological data. And your neurobiological reporting are also neural functioning. Those can be obtained, and usually professionals like when neurobiological data or kind of thing is required, those neurobiological professionals, they will be doing it like that. ତେଣୁ ଆମେ introduction ପଢିଲେ ସାଇକୋଡାଇନାମିକ୍ସ କଣ, ସାଇକୋଡାଇନାମିକ୍ସ ର ବେସିସ୍ କଣ ଏବଂ assessment କେମିତି ସାଇକୋଡାଇନାମିକ୍ସ ର ସମସ୍ତଙ୍କ ଠାରୁ is the most significant goal, and how psychodynamics can be used for the measurement purposes. ए भितरे बहुत ECG, EEG, MEG, MRI, these are some kind of things for psychophysiological data. Now, this part is over. Any question about this part? Introductory part. Introductory part रे मु जो जिनस कहली methods of measurement कौन, psychodynamics कौन, psychodynamics रो major objectives कौन, हमें कौन पाई psychodynamics पढ़ुचु एवं as assessment as one of the major objectives हमें कौन सेथिरे कौन assessment करि परिबु, को method रे assessment करि परिबु. Any question? नहीं तमे कहीं न पचारला माने मैं assume करते जे you don't have a question, you understood it. Now next, let us go. Second one, practical applications. Now when we think and say about psychodynamics as the process of measurement and understanding about normal as well as clinical psychological events, things साधारण जिनस एवं क्लिनिकल जिनस मेजर करिबा एवं ताक बुझिबा एवं जानिबा जनक पर्सपेक्टिव रे बा ग्रुप पर्सपेक्टिव रे हम तो साइकोडायनामिक्स बोली कहूछु. प्रैक्टिकल एप्लीकेशन कोन, assessment of intelligence and other aptitude functions. Now whenever we are interested in psychodynamics, आमर psychodynamics रो काम गोटे काम आमे अप्लाई करिकरी आमे मेंटल स्किल, इंटेलिजेंस एवं अन्य समान टाइप रो स्किल जोटो आमे भाबुची रिलेटेड टू द प्रोसेसेस ऑफ लाइफ, मेंटल हेल्थ आमर का माने दक्षता पे जो जिंस दरकार सेगुडा का आमे मापी पारिबो, मेजर करि पारिबो एवं ताकू we can understand about a person's perspective. ये लोकर बुद्धि या ये लोको या करिबो, ये लोकर बुद्धि एति कम ये लोकर या सुविधा हबो, ये लोकर aptitude रे ई प्रॉब्लम अछि, this is what is likely that the person will have. Those kind of things we will do. Now next, IQ विषय केमिति IQ मेजर हबो, केमिति हबो कोन हबो से गुडी को डिस्क्राइब कराला. IQ कोन, टोटल IQ कोन, परफॉर्मेंस IQ कोन, verbal IQ कोन, Whistler's intelligence scale कोन, ए जगह रे assessment of IQ टिके दिया हिला. as IQ कोन जोटा कोन केमिति मेजर हबो, कोन टेस्ट अछि, टेस्ट माने ये कोन, those things are there. Now psychological assessment in clinical context. How would important बड़ जिंस होला assessment in clinical context. हमें इंटेलिजेंस मापी परिबु हमर आवश्यकता अनुसार, otherwise it is not that always clinical situation रे केवल हमें इंटेलिजेंस दरकार. हमें स्कूल रे पिला मानकर मध्ये इंटेलिजेंस टेस्ट करि परिबु as a normal process of assessment, किंतु particularly clinical process रे when someone is having some issues, some problems, mental health issues, problems like that, हमें मध्ये psychological assessment clinical context रे use करि पारिबु. But psychodynamics has its use in the clinical process. तेनु माने जे कोनोसी clinical setting रे clinical माने I hope you all understand what is clinical. Clinical means whenever someone is having any kind of issue, mental health issues or normality issues, functional normality issues like that. तेनु clinical issues रे हमें use करि परिबु. Then third, psychodynamics can be used for the assessment in vocational testing, job selection and placement. You know, these are the most commonly used kind of psychodynamics, जोठी की कोनोसी चाकरी पई आवश्यक हला हमें यूज करि पारुछु, कोनोसी सिलेक्शन पई आवश्यक हला हमें यूज करि पारुछु. Whatever examination you are giving, that the psychological aspect is psychodynamics. ତମେ କୌଣସି ଚାକିରି ପାଇଁ ପରୀକ୍ଷା ଦଉଛ, କୌଣସି ଭୋକେସନାଲ ଗାଇଡାନ୍ସ ପାଇଁ ପରୀକ୍ଷା ଦଉଛ, କୌଣସି ମାନେ ଜବ୍ ପାଇଁ ପ୍ଲେସମେଣ୍ଟ ପାଇଁ ପରୀକ୍ଷା ଦଉଛ, ସେଇ ଯୋଉ ମେଜରମେଣ୍ଟ ପ୍ରୋସେସ ଦ ଯୋଉମାନେ ରେସ୍ପନ୍ସ ମାନେ ଇଏ କରୁଛନ୍ତି, ସେ ଯୋଉ ମେଜରମେଣ୍ଟ ଯୋଉ ଆସ୍ପେକ୍ଟ ଆପ୍ଲାଏ କରୁଛନ୍ତି, ଦ୍ୟାଟ୍ ଇଜ ଅଲସୋ ସାଇକୋଡାଇନାମିକ୍ସ, ଦ୍ୟାଟ୍ ଅଲସୋ କମ୍ସ ଅଣ୍ଡର ସାଇକୋଡାଇନାମିକ୍ସ। ତମକୁ ମାନେ ଯୋଉ କ୍ୱେଶ୍ଚିନ୍ ଦିଆହଉଛି, ମଲ୍ଟିପଲ ଚଏସ୍ କ୍ୱେଶ୍ଚିନ୍ ଦିଆହେଲା, those are also format of psychodynamics analysis. Like that. Then let us sum up. Unit 1 is over. Now, any question about Unit 1? Introduction, methods, and applications. তিনটা জিনিস এর ভিতরে আছে। Psychodynamics কোন? What are the different methods of psychodynamics? এবং psychodynamics এর common application field কোন? কোন জায়গায় আমি psychodynamics কি ইউজ করুছি? No question. Now, next unit is methods of behavioral assessment. We have already discussed there are different requirements of assessment, but now one of the major thing is behavioral assessment. And what are those methods? ଯୋଉଟା ଆଗରୁ ଆମେ କହିଛି କଣ କଣ, କିନ୍ତୁ behavioral assessment କଣ କଣ ଦରକାର, ଅନ୍ୟ assessment ବି ଅଛି, ତା ସାଙ୍ଗରେ behavioral assessment is a major dimension. ଯେକୌଣସି ଇସ୍ୟୁ ପାଇଁ କ୍ଲିନିକାଲ ପର୍ପସ ହଉ, ଫର ଏନି ନର୍ମାଲ ଇନଭେଷ୍ଟିଗେଟିଭ ପର୍ପସ ହଉ, behavioral dimension is important. ତେଣୁ କଣ କରାହଉଛି, these are the things: introduction, objectives, behavioral assessment, assessing the target behavior, self report methods, ଏଗୁଡ଼ା describe କରାଯାଇଛି। ମୁଁ ସବୁଗୁଡ଼ା ଟିକେ ଟିକେ କହିଦଉଛି। behavioral assessment goals କଣ, why do we measure behavior, or what is the kind of situation where you are supposed to measure the behavior, କେତେବେଳେ ଆମର behavioral assessment ଦରକାର। Now, behavioral assessment and traditional assessment. The initial goals of assessment are to identify and construct a case formulation of clients' difficulties that will guide the clinicians and patients towards potentially goal. साधारण भाବରେ whenever we are measuring any kind of, supposing for normal purpose, we are conducting an interview for a job. It's a normal purpose of behavioral assessment. That is also a kind of behavioral assessment. Since the behavioral assessment goals ରହିଲା, behavioral assessment, traditional assessment and a traditional assessment, ମୁଁ ଖାଲି କହିଦଉଛି ତମକୁ ଇମ୍ପୋର୍ଟାଣ୍ଟ ଜିନିଷ ଗୁଡାକ। focus on behavioral assessment, assumptions and perspectives of behavioral assessment. আচ্ছা, now ମୁଁ ଖାଲି ଟିକେ ମାନେ ଓଭରଅଲ ଆଇଡିଆ ଦେଇଦଉଛି ଯେ behavioral assessment means whenever you are using any kind of methods, any kind, to know, understand a person from his external and apparent behavior that he shows, and also in some extent by applying certain methods, the internal quality of the person which controls or manages his behavior. ଆମେ ଯେତେବେଳେ ବାହାରକୁ ଯେକୌଣସି ବ୍ୟବହାର ଦେଖଉଛୁ, ଯେକୌଣସି ପରିସ୍ଥିତିରେ, ଯେକୌଣସି ସମୟରେ, it is being guided by some of our systems, psychological systems. ଆମ ବ୍ୟବହାରଟା ସବୁବେଳେ ଗୋଟେ ସାଇକୋଲୋଜିକାଲ ସିଷ୍ଟମ, ସାଇକୋଲୋଜିକାଲ ଅପରେସନ ଭିତରେ ହିଁ ଆମେ ଦେଖଉଛୁ। ଏବଂ ଡିଫରେଣ୍ଟ ଲୋକ ଡିଫରେଣ୍ଟ ବ୍ୟବହାର ସମାନ ସିଚୁଏସନରେ ଅଲଗା ଅଲଗା ବ୍ୟବହାର ଦେଖଉଛନ୍ତି, କାରଣ their psychological makeup is not same. ସେ ପର୍ସନାଲିଟି ହଉ, ସେ ଇଣ୍ଟେଲିଜେନ୍ସ ହଉ, ସେ ମୋଟିଭେସନ ହଉ, whatever. If you are motivated for a thing, your behavior will be different externally and internally when you are not motivated for a kind of thing. ତେଣୁ behavioral assessment gives us provisions or provides us kind of things that help us to know and understand a person. Now, behavioral assessment ମୁଁ ଖାଲି ଆଇଡିଆ ଦେଇଦେଲି, ତମକୁ ଏଗୁଡାକ ତ ପଢିବାକୁ ପଡିବ। କାହିଁକି behavioral assessment, କଣ ଫୋକସ ରହିବା ଦରକାର, what are the things that you are supposed to focus in behavioral assessment. Those kind of things are there. Assumptions and perspectives of behavioral assessment, like that. And then assessing target behavior. Now, out of these discussions, you will come to know that whenever you are doing or conducting any assessment or behavioral assessment, you have a target. You are just not assessing someone's behavior on a blank sheet. Or blank. Kichhi kaam nahi mu ta behavior assess karuchi. No, it's not a kind of thing. Always, whenever you are supposed to assess any kind of behavior, it has a target. For some purpose, you are doing it. Maybe it is a clinical purpose. Maybe it is a purpose of job selection. Maybe it is a purpose of assigning some activities. Maybe it is a leadership. Whenever you are doing any kind of behavioral assessment, you have a purpose. And for that purpose, what is the target behavior I'm saying? For that purpose, supposing you are making a behavioral assessment for a person to become to be selected for a job, and you have to find out some behaviors which are responsive to that job or job fit. In that case, your target behavior will be assessment of target behavior will be different. तमे जदि कि जनकु जॉब ପାଇଁ सिलेक्शन करूछ जो बिहेवियर देखिबा दरकार जनकु क्लिनिकल प्रॉब्लम ପାଇଁ बिहेवियर असेसमेंट करूछ सेया दरकार नाही. For different purposes, the behaviors needed are different. Therefore, whenever you are measuring, your target will be different. That we call target behavior. Target behavior means कौन ପାଇଁ तमे behavior जानियो ପାଇଁ चाहुछ. सेथिପାଇଁ जो behavior दरकार सेही दोडा कला target. The same behavior is not required for a job and for marriage. Marriage by behavior alga darkare, job by behavior alga darkare. Not that there are not co-behaviors or confounding behaviors, but some stage. When you are planning it like this for assessment, you have some target. This is called selection of target behavior. Call target behavior tomorrow. Tapare asila different methods. Self-report methods. Nowadays, one of the most popular and most convenient way of assessing someone, although it has limitations. There is a due limitation achi, but some popular or mostly used. Self-report method means you will be given certain kinds of questions, statement, issues, and you will have to report. Largely, tame jaha psychological test use karucho. Je konosi manekar tamara achi jaha practical le achi manekar. State and trait anxiety. Kichi statement achi. Je konosi jinisa. And you are supposed to respond to that statement in your way in a selective program like thing. Tame strongly agree, mildly agree, disagree, like that you will have to respond. And whenever you are giving the response by yourself to kind of things, it is a self-report method. Tamku tomo response opre tame judgment habo. Mane you are reporting yourself. That is kind of thing, self-report method. And then examples of self-report method diya MMPI as a personality test. 16 personality factor questionnaire. तमर एगुडा सब अछि तमर practical रे at one time I think 16 PF was there, MMPI was there, practical तमे करिछो, Californian personality inventory एगुडा करे तमे निजुको assess करि करि तमे report करूछो. On the basis of that report you will be assessed. तमे कोन कलो self report. एवं तमे जदि सेठी तम निजर assessment रे fail कलो, and the report will ultimately fail. You will fail in your report. Supposing mu chahibi je tomaro but currently one of the most important thing is about emotional intelligence. Let us suppose mu tomaro self report re emotional intelligence mapiba pai chahunchi, mu janiba pai chahunchi as a clinical psychologist, by whatever, as a marriage counselor, whatever my purpose is, depending on my purpose. mu jodi janili je tomaro emotional intelligence hochi oda abasyaka jinish for this kind of thing. एवं इमोशनल इंटेलिजेंस रो कोन कोन तमरो अछि मु जानिया पे चाहिली. I can suggest you basically lot of things are being there as online assessment. मु तमको सीधा न पचरी करी त न जणे न जानि करी माने डायरेक्टली ये न करी करी मु ऑनलाइन मध्ये तुमको एडवाइस करि परिबी गिव योर टेस्ट एंड गिव मी अ रिपोर्ट बुझ परछो ना नाही online आजिकली largely online tests are available for different kinds of self report measures which you can yourself assess and report to the concerned person or counselor jar darkar taku dei paribo manakaro do anybody having any idea about online measurement supposing emotional intelligence kichi idea achi karan tama nijara online measure kariba pai having your own time ऑनलाइन मेजर करबा पई कार किछ आईडिया अछि कि केम जानि छ कि तम निजर इमोशनल इंटेलिजेंस त मापि भी चाहू छ एनीबॉडी बनजा
Yes, sir.
डू यू हैव एनी आईडिया अबाउट हाउ टू मेजर योर इमोशनल इंटेलिजेंस
No,
ऑनलाइन एंड
sir.
रिपोर्ट
No,
हाउ
sir. I have idea about only personality, system personality questionnaire.
anybody else ऑनलाइन मते मेजर करी करी तमे यू कैन रिपोर्ट supposing I am your counselor and I want that you should give your online self report measure of emotional intelligence नहीं लेख मु कहूची गोटे इमोशनल इंटेलिजेंस टेस्ट ट्रूइटी TRUITY सीधा जाइकिरी it will take time you can take your time you can measure your emotional intelligence and you can understand your empowerment with respect to your emotion or your weaknesses with respect to your emotion by that is I'm giving it as an example of self report measurement hello lekhilo
Yes, sir.
emotional intelligence test TRUITY TRUITY that you can measure your emotional lot of things several things are there this is what I have just given an example now strength and weaknesses of self report inventory self report inventory is now very popular because of its convenience ମୁଁ ବର୍ତ୍ତମାନ ତମକୁ ଇମୋଶନାଲ ଇଣ୍ଟେଲିଜେନ୍ସ ରେ ସେଲ୍ଫ ରିପୋର୍ଟ ମେଜର ଟେ କହି ଦେଇକିରି ମୋର ଆଉ କିଛି କାମ ରହିଲାନି ତମେ ମେଜର କରିକିରି ମତେ ରିପୋର୍ଟ କରିପାରିବ तम विषय तमे मेजर करी मते रिपोर्ट करि परिबो किंतु सेल्फ रिपोर्ट इन्वेंटरी is not always the right kind of choice it has limitations advantage अछि popular second advantage hela quick third advantage hela the respondent is more responsible for his or her own report किंतु यार disadvantage भी अछि disadvantage common what are the kinds of common disadvantage strength lekhuchi results of self improvement are generally much more reliable and valid than projective test ame jodi compare karibu projective test saito projective test re jehetu whenever we are administering the stimulus is unstructured therefore maybe we believe that the unconscious is reflected in that but sometimes it is not as much relevant as whatever you say it directly गोटे इनडायरेक्टली तुम विषय जानिबा गोटे डायरेक्टली तुम विषय जानिबा इट मेक्स अ डिफरेंस दैट इज व्हाट इज सेल्फ रिपोर्ट इज मोर डायरेक्ट देन तबरे स्कोरिंग प्रोसीड्यूर इज मोर क्लीन सेल्फ रिपोर्ट देयर आर 5 स्टेटमेंट्स 5 points 0 1 2 3 4 you give 4 means most likely that is the best answer from you and we get it done scoring is very easy whereas projective test scoring is difficult tapre administering self report is easy and less expensive also projective test itself is costly any projective test you buy and apply it is costly then application is also you cannot apply it on different platforms without your presence like that you read it kahi ki mane self report ra advantage kono different disadvantage kono now self report ra format sabu kono what are the kinds of self report mu gote khali कहली format ta sangre interview is also a self reporting method it's a direct face to face method of reporting yourself I am on the other side of the table. I am the interviewer. You are the person who is appearing the interviewee. I ask you question, you give your answer. I observe you. I listen to your responses. I observe you. I understand your body language. And that way I can make an assessment about you directly. And that is also one of the self-reporting. You are reporting yourself in the interview. That is a very easy and most widely acceptable way of self-report method, interviewing. Questionnaires, जोटा मु कहिली सेल्फ रिपोर्ट रे जे कोनसी जिंस जोटा मु तुमको कहिली माने ये emotional intelligence or measurement पाई, that is a questionnaire method. There are questions, you have to give your options for that questions. ताले तमे जानि परिबो जे केमि तमर कोन ऑपरेट करूची. Questionnaire, a rating scale. Rating scale means, say there are different format of kind of things, and you will be giving a response, and you will be rated by some kind of judgments. Almost questionnaire is a kind of rating scale. You rate yourself on that. But rating scales can also be used for other kinds of situation. Thought, listening, and think aloud procedures. Now, you will be given certain topics to verbalize, to say, to be. Supposing I will be giving you a topic that you make out your points of view with respect to divorce. How do you, what is your opinion kind of things? And when you say something about that, the other person, the counselor, the client, the clinical person, assessment is the person who is conducting the clinic, he can also take out some kind of things. Thought aloud and then direct observation and self-monitoring. ବର୍ତ୍ତମାନ ପର୍ଯ୍ୟନ୍ତ କାହାର କଣ ପଚାରିବାର ଅଛି ନାଇଁ. Next thing is a direct observation and self-monitoring. How ଗୋଟେ method where the clinician, clinical investigator, or the person who is taking assessment, any kind, he can observe you in some situations in field when you are in activity. You are doing certain things and the person is observing you in that and making, by his expertise and experience, making assessment of you. ତମେ 5 ଜଣଙ୍କ ସହିତ ଅଛ, ତମେ କେମିତି କଥାବାର୍ତ୍ତା କରୁଛ, ତମେ କେମିତି ବିହେଭ କରୁଛ, ତମ ବିହେଭିୟର କୋଉଠି ଲାପ୍ସେସ୍ କଣ ରହୁଛି, ଗୋଟେ ଗ୍ରୁପରେ ବସେଇକିରି ସେ can also make those kind of assessments. And those are called direct observation, and which are more required for children who are not able to give their verbal response. जो माने ठीक रे तांकर ये रे करि परिबेनी, माने इन्वेंटरी की यूज सेल्फ इन रिपोर्ट इन्वेंटरी रे रेस्पोंड करि परिबेनी, by any kind of deficit, disadvantaged people. सेमानक पाई self direct observation is more important. किबा जो माने clinically actually माने clinical state of affairs से जे सेमाने को ये करि परिबेनी, that is the direct observation is more required. Now तार disadvantage कौन, direct observation रे disadvantage कौन, major disadvantage है the clinical investigator may have a biased look towards them if he or she is not properly trained. Maybe in a particular situation all the things cannot be observed. এই টাইপৰ ଅଛି ସବୁ মেথডৰ advantage ଅଛି, disadvantage ଅଛି, ଲେଖା ହେଇଛି. ତାପରେ types of direct observation, these are unobstructive observation. कौन, continuous monitoring ଗୋଟେ type, ଯୋଉଠି କି you observe a group and after every 10-15 minutes you say you do it like this, you then you observe, you do it like this, you do this thing, you do that thing, like that. That is continuous monitoring and observation. Then unobstructive observation, you don't do anything, you allow them to do whatever they like. ଯାହା को observe କରୁଛ ସେ ତା ଜାଗାରେ ଯାହା କରୁଛି, ତମ କାମ ହେଲା ତାକୁ observe କରିବା ଏବଂ ତାର behavior assessment କରିବା. That is unobstructive. କିନ୍ତୁ ଅଧିକା ମାନେ obstructive, unobstructive and continuous changing. behavioral trace studies involve finding things people leave behind and interpreting them. Now, whenever sometimes some people do certain things, and after it has been done, something is left out. କିଏ ଜଣେ ପିଲା ଖାଉଛି, ଖାଇସାରିଲା ପରେ whatever the kind of things is left and how the place is organized. ତମେ ତ ଜାଣିବା ପାଇଁ ଚାହୁଁଛ ଇଏରେ. That can be also a kind of thing. Disguised field observation. ଏଗୁଡ଼ା ସବୁ ଟିକେ ଟିକେ concept ଖାଲି ମୁଁ କହିଦଉଛି. Disguised field observation ମାନେ you will not the person whom you are observing, ପିଲାମାନଙ୍କୁ ତମେ observe କରୁଛ, ସେ ଜାଣିବନି ଯେ ତମେ ତାକୁ observe କରିବା ପାଇଁ ଆସିଛ. ତମେ your identity and your purpose will be not ମାନେ known to them. ସେମାନେ ଜାଣିବେନି ଯେ ତମେ ତାକୁ observe. They will be free to do their things and you are at your liberty to observe. That is disguised field observation. Analog, ଏଗୁଡ଼ା ସବୁ ପଢିଥିବ, self monitoring, all those kind of things. ଗଲା. Now another important aspect, এটা କଣ unit 3 ଆସିଲା ନା କଣ? Anyway, methods ନାହିଁ, ସେଇ methods of behavioral assessment ରେ ମୁଁ ଖାଲି ଗୋଟେ ଜିନିଷ କହୁଛି, ଯୋଉମାନେ ଚାହୁଁଛ ମତେ ମଝିରେ କିଛି ପଚାରିବା ପାଇଁ, they are at liberty, they can ask me whenever they want to. କାରଣ ମୁଁ ଖାଲି ମେନ୍ ଥିମ୍ ଗୁଡାକ ଗଡେଇ ଗଡେଇ ଯିବି. ଦିସ୍ ଇଜ କାଉନସେଲିଂ କ୍ଲାସ୍. ତେଣୁ ଗୋଟିଏ କ୍ଲାସରେ ଗୋଟେ ବ୍ଲକ୍ କମ୍ପ୍ଲିଟ୍ ହବ, 4ଟା କ୍ଲାସ୍ ପାଇଁ 4ଟା ବ୍ଲକ୍. any question? ନାଇଁ. Now, a psychophysiological assessment. Psychophysiological assessment aspect refers to all those kinds of assessment programs and procedures which involve any kind of your physical and mental aspects of measurement. Tamara, supposing your EEG, you say that what is the EEG in kind of measurement of psychological process? Yes, there are kind of your neurological functioning, your even those kind of things ତମର କଣ କୁହାଯିବ, endocrine functioning, ସବୁ, all those things are a part. And the these kind of measurements, even your psychophysical measurements as we commonly do it, is your RL, DL, those kind of things. They are also in some point they are required for any clinical investigation. ଆମେ clinical investigation ଖାଲି behavior, cognitive and mental level le ସରି ଯିବନି. There are also physiological requirements for confirmation of certain kinds of things. ଆମେ ଯାହାକୁ neurobiological assessments ବୋଲି କୁହାଉଛି. And doctors and other professional neurologists, they should be a part of this kind of measurement. ସେମାନଙ୍କ ହାତରେ ଏଇ ଯୋଉ measurement aspect ଦରକାର ପଡେ, ସେମାନେ they are the kind of things. ସେମାନେ ଆମକୁ ରିପୋର୍ଟ କରିବେ ତମର endocrine functional dysfunctional ଏୟା ଅଛି, ତମର neural conductivity ଏୟା problem ଅଛି, ତମର EEG ଏୟା ଅଛି, ECG ଏୟା ଅଛି. Those kind of things can also be some kind of use in clinical investigation and assessment of clinical status. Now, unit 3, any kind of thing. Okay. 1 minute rest. मतलब के पानी କେହି କିଛି ପଚାରିବାର ନାହିଁ. ନାଇଁ, ନ ପଚାରିବାଟା ମାନେ ଇଏ ନୁହେଁ. ତମେ ୟୁ କ୍ୟାନ୍ ହାଭ୍, ମୁଁ ଖାଲି ବେସିକ ଜିନିଷ ଗୁଡା କହିଯାଉଛି, କାରଣ that is my assignment and duty. I cannot be very ମାନେ elaborate in any kind of things. ତେଣୁ ତମର now assessment in clinical psychology unit 3 ମୁଁ କହିଛି ଚାରିଟା ୟୁନିଟ୍ ଅଛି ପ୍ରତି ବ୍ଲକରେ ଆମେ ତାକୁ 2 ଘଣ୍ଟାରେ କଭର କରିବା କଥା ତମର ଯଦି କିଛି ପ୍ରଶ୍ନ ଇଣ୍ଟରାକ୍ସନ ରହିବ ସେଟାକୁ ମଧ୍ୟ ଆସେଣ୍ଟ କରିବା କଥା କିନ୍ତୁ କରିବା next is assessment in clinical psychology up to now although I have told you about the clinical programs assessment kintu we have been discussing some general assessment kind of things in psychodynamics. Psychodynamics is not just psychodiagnostics. Psychodiagnostics is not just clinical. For other purposes, it can be used also. Diagnostic assessment, lot of other ways it is used, as I have told you, for professionalism, for job selection, for any kind of thing. In lot of other ways this is being used. Now, clinical, what is specific about clinical psychology and assessment? This is the unit. Now, what objective are there? One, what are the clinical investigation, psychodynamics, psychodiagnostics as clinical investigation? Kon taro basic. Actually, now we come to the actual requirement part of the psychodynamics. Basically, because if you are like to be supposed to be professional in clinical psychology, that is the kind of thing. One, objectives are define and describe the psychological assessment in clinical setting. Now, whenever we are making use of psychodiagnostics for any clinical purpose, we have to define different kinds of approaches, different kinds of tests, clinical relevance of those tests, how by availing measurement in those tests we will be able to use it for our purpose. We can understand the client's problem. We can make some arrangements of the recovery or the interventions for the client. एभले आमे करि पारि आमे जानिले assessment जेमति आमे मेडिकल कोनोसी मेडिकल रिक्वायरमेंट पे आमे गले हमको टेस्ट कला पर डॉक्टर देखि कि the doctor is in a position to help us. Same amar mode assessment clinical setting re काम दबो. Then explain different types of psychological assessment. Now, the second corner, as we have already discussed, psychological assessment gotiye prakar nahi. Any kind of assessment, behavioral, cognitive, thinking, reasoning, whatever kind of assessment you make about a person, it has some relevance, and there is no single way to measure everything about a person. बहुत प्रकार मेजरमेंट अच्छी एवं से सबू तारो टाइप्स कौन कौन अच्छी जेन आमे इंटेलिजेंस टेस्ट कहलु, एप्टीट्यूड टेस्ट कहलु, इमोशनल इंटेलिजेंस टेस्ट कहलु, स्पेसिफिक कैरेक्टरिस्टिक्स मेजरमेंट टेस्ट कहलु, विभिन्न टेस्ट अच्छी एवं सबू एवरी टेस्ट हैज इट्स ओन वे ऑफ एक्सप्लेनिंग थिंग्स अबाउट ए पर्सन. So I may explain different types of psychological tests. Explain the purpose of a clinical assessment. Now the question is, if you are using an assessment for any clinical purpose, for any clinical, what is the requirement? Purpose. Specific purpose kono. Mu emotional intelligence measure kariya pai to mu kohili. Kahi kohili. Kon pai kohili. What is the thing that I am interested about? Then only I can apply that test. Khali so moto I cannot just suggest you test this. Whenever you go to a doctor, they advise you certain test on believing on certain purpose of that test. Jamanta test kariya bhi kohi dete. See now, explain the referral and assessment. Now sometimes supposing something comes to you which you understand it's beyond your scope to intervene. Tome kich kari paribani. Se jagare you have to get for some assessment. You tome refer karibo. By that assessment, तमे कहउछ ना एई टेस्ट टा हेले जणा पड़िबो जदी इतरे if things are positive जेम जदी पॉजिटिव आसला से माने इट्स नॉट इन देयर हैंड से आजने खाको स्पेशलिस्ट पाको पठे देबे and like that for referral also sometimes we have to make some clinical assessment describe the assessment in clinical psychology gola sarla तापर definition and purpose of clinical assessment purpose mu कहइतली definition of assessment psychological assessment psychologists as detectives comprehensive assessments psychological गड़े जाउची जो important tools reliability and validity 8 टिके हम खाली कहि दोची important point उडा को now coming to a test reliability and validity now when you make a physical a concept खाली जाय के कहउची इत पे the psychological test this is these are the kinds of basic necessity and requirements and if it is not being done it is liability हमें ताको सबु बेले कहउछु जे तार माने साइकोमेट्रिक्स वैलिडिटी कोन साइकोमेट्रिक प्रॉपर्टीज कोन अछि जे कोनोसी टेस्ट सेटा न होले वी मे बी गिवन ए रॉन्ग वे टू गो नाउ रिलायबिलिटी वैलिडिटी कहले या whenever you are supposing you are measuring your weight height in a particular instrument your height is being measured by a particular instrument if you measure your height you are 5 feet 3 inches today and tomorrow you measure yourself you are 5 feet 5 inches what is the wrong with that measurement is it your height has increased tomorrow or the instrument in measuring instrument is wrong the
The measuring instrument is wrong.
measuring instrument is wrong because your height cannot be 5 feet 2 inches 3 inches today and 5 feet 5 inches tomorrow measuring instrument is wrong similarly also when you measure your weight if it varies in several measurements then the measuring instrument you conclude that the measuring instrument is wrong but you so easily conclude when it is a kind of physical measurement but do you expect that the same thing will also be a kind of thing in psychological measurement psychological measurement रे समान घटना हबो ना नहीं भूल टेस्ट रहइबो ना नहीं
Yes, sir.
हाँ naturally that means if the test is not giving you a consistent measurement जदि आज 5 फुट 2 इंच काली 5 फुट 5 इंच पर दिन 5 फुट 3 इंच हाइट बाहरुची जो स्केल रे मापुचन से स्केल भूल same thing if your emotional intelligence by measuring your emotional intelligence by a test today it is in a particular dimension self awareness re 86% achi tomorrow it is 45% means it's not measuring the scale is in difficulty that we call the reliability of test that means the scale is not dependable you cannot measure in that test and that means reliability I mean common sense re कहउछु reliability is the consistency of measurement by a test and if a psychology physical test re you can understand very quickly the unreliability of a physical test आज 5 फुट 3 इंच काली 5 फुट 5 इंच माने से टेस्ट सिथरा मापिबार नहीं that is a wrong test but if the same thing happens in psychological test it's not that easy to understand because it's a different kind of measurement but unless a test gives a consistency of measurement across occasions the test is not reliable यदि बहुत vary करूची गोटे टेस्ट रे for measurement of a measurement of skill that is an unreliable test and that is most important in psychological tests before you use any kind of clinical investigation you must at least check these kind of 2 parameters of the test and the other one is validity validity is a very peculiar concept in psychological measurement which is not very relevant to physical measurement for example supposing you take your height measurement by a scale will it be that while you are measuring the height it will tell about your weight mo height मापुतली मोर से height न कहि कि मो weight टा कहला 55 केजी मु height मापिया पे ठिया छि weight टा बाहर छि 55 केजी can it happen usually can it happen with an instrument of physical measurement
No, sir.
No. Height wala height mapibo, weight wala weight mapibo. But that guarantee is not there in psychological measurement. Sometimes you are measuring a specific thing of a person, but actually the test is measuring something else. Because it is a kind of psychological measurement, behavioral measurement, issues, measurement of human being. Manisha vishayare jete measure karuchi, and you know, human being is not just a simple system, it's a very complex system. ତେଣୁ ବେଳେ ବେଳେ ଗୋଟେ ଗୋଟେ ଟେଷ୍ଟ କ'ଣ କରାଯାଇଥାଏ, ଇଟ୍ ଇଜ ବିଂ ଡେଭଲପ ଫର ଏ ପର୍ଟିକୁଲାର ପର୍ପସ, କିନ୍ତୁ ସେଇଆ ସେ କରେ ନାହିଁ। ଇମୋସନାଲ ଇଣ୍ଟେଲିଜେନ୍ସ ମାପିବା ପାଇଁ ଟେଷ୍ଟ ତିଆରି କରାହେଲା, ସେ କିନ୍ତୁ ଦେଖିଲା ବେଳକୁ ମାନେ କ'ଣ ମୋଟିଭେସନାଲ ଷ୍ଟ୍ରେଂଥ ମାପୁଛି, ଇମୋସନ ମାପୁନି। ଏଭଳିଆ ଘଟଣା ବହୁତ ଘଟେ, ଘଟିବାର ସମ୍ଭାବନା, କାହିଁକି ଦିସ୍ ଇଜ ହ୍ୟୁମାନ ଆସେସମେଣ୍ଟ। ସେଇ ଜାଗାରେ ଭ୍ୟାଲିଡିଟି ଅଫ ଦ ଟେଷ୍ଟ ଇଜ ରିକ୍ୱାର୍ଡ। Different kinds of validity ଅଛି, ବହୁତ ପ୍ରକାର ତମର ପଢିଥିବ ଆଗରୁ। ତେଣୁ validity is the now reliability and validity before any kind of a clinical investigation. The test must be certified by the counselor, by the clinician, that yes, this is a reliable test as well as this is a valid test. And they are usually advised not to use wrong tests for any kind of assessment. ଭୁଲ ଟେଷ୍ଟ ବହୁତ ଅଛି, ଆଜିକାଲି rampant ଟେଷ୍ଟ ସବୁ ବାହାରିଲାଣି, ତେଣୁ ସେଗୁଡାକ କରିବା ଉଚିତ ନୁହେଁ। ତେଣୁ ରିଲାଏବିଲିଟି, ଟାଇପ୍ସ ଅଫ ସାଇକୋଲୋଜିକାଲ ଆସେସମେଣ୍ଟ। ବର୍ତ୍ତମାନ ଆମେ ଆସିଲେ, ମୁଁ କହିଦେଲି ତମର କ'ଣ କ'ଣ ସାଇକୋଲୋଜିକାଲ ଆସେସମେଣ୍ଟ ଦରକାର। ଗୋଟେ ମେଜର ଆସ୍ପେକ୍ଟ ଆସୁଛି ଇଣ୍ଟେଲିଜେନ୍ସ, ପର୍ସନାଲିଟି, ଏଗୁଡାକ। ଇଣ୍ଟେଲିଜେନ୍ସ ଟେଷ୍ଟ ଅର ଆଇକ୍ୟୁ ଟେଷ୍ଟ କେତେ ଗୁଡେ ଜାଗାରେ ଫର କ୍ଲିନିକାଲ ଇନଭେଷ୍ଟିଗେସନ ବା ସାଇକୋଲୋଜିକାଲ ଇନଭେଷ୍ଟିଗେସନ, intelligence is considered as one of the most significant parameter. बुद्धि मापिदेले आमे बहुत कथा जानी, गोटे लोक विषय लोकर बुद्धि कौन से अनुसार आमे बहुत कथा जानी। किंतु all of you know that this measurement of intelligence is not same as it was 30 years back, 35 years back. Until 1990, intelligence concept was only a singular concept. IQ means ମାନସିକ ବୁଦ୍ଧି ଯୋଉଟା କୁହାଉଥିଲା କେବଳ ବୌଦ୍ଧିକତା, ଯେ ପରୀକ୍ଷାରେ ଭଲ କରିବ, ପାଠ ଭଲ ପଢିବ, କଗ୍ନିଟିଭଲି ବେଟର ହବ, ଏଇ ଜିନିଷକୁ ବୁଦ୍ଧି ବୋଲି କୁହାଇକରି we consider them as intelligent people in the society. କିନ୍ତୁ ତାପରେ ନୂଆ ନୂଆ ବୁଦ୍ଧିର ନୂଆ ନୂଆ କନସେପ୍ଟ ସବୁ ଆସିଲା। no more the same intellectual intelligence is the only aspect of life. Now cognitive, emotional intelligence, the new concept being created in 1992, which is called the emotional intelligence. तमे बहुत बुद्धि आइकरी मध्य, if you are deficient in having emotional intelligence, you will not be successful. Emotional intelligence कौन कहले ना, the person who is having the kind of skill to manage his or her emotion as well as to manage the emotion of significant others. तम निजर इमोशन को मैनेज करिबा, कंट्रोल करिबा, ठीक बाटरे चलेबा, एवं तमर लाइफ रे जो माने इंपोर्टेंट सेमान को इमोशन को मते ठीक बाटरे मैनेज करिबा, कंट्रोल करिबा, दैट इज द स्किल ऑफ इमोशनल इंटेलिजेंस। तादरे अछि बहुत जिंस, मु खाली आइडिया दो पे कहि दोछि। एंड नाउ इट इज IQ, EQ, now and the measurement aspect is called EQ, and nowadays EQ is more important in life than IQ. IQ किछटा कमी गले चली जिवो, EQ कमी गले आउरी विपद। Now similarly, but in around 2002-3, another very high format of intelligence has been discovered about human being. मनुष्य आउरी अधिका बुद्धि ता भितरे अछि, से कथा बाहरला, जोटा को से माने they called it spiritual intelligence. And spiritual intelligence is not intelligence like that of Baba and ye se jo dharma Baba eguda kanme. Spiritual intelligence means basically it is defined as the ability of a person to foresee the consequences of his present action in future terms. Visual intelligence definition है, तमे आजी कौन करूच, ये घटनार भविष्यत कौन तुमको जदि जना पड़ुची, तमे जदि बुझी पारुच, जानी पारुच, मु आज एटा कले मोर या भविष्यतर असुविधा हबो, 5 वर्ष पर मोर या असुविधा हबो, then you are spiritually loaded, spiritual intelligence, and that is more higher form of तमे जदि ए तीनिटा को इंटेलिजेंस रो माने स्ट्रक्चर देखिबो जाईकरी ब्रेन रे तम देखिबो जे योर इंटेलेक्चुअल इंटेलिजेंस जोटा को पुराना हमें इंटेलिजेंस कहउछु आईक्यू जोटा सेटा तमरो जोठी काम करूची राइट साइड ऑफ योर ब्रेन सॉरी लेफ्ट साइड ऑफ योर ब्रेन in emotional intelligence is being functioned by your right side of the brain एवं ये दीटा को कंट्रोल करूची तो टोटल ब्रेन इज योर एसक्यू स्पिरिचुअल कोशेंट रो अर्थ धर्म बा ए जो नुहे स्पिरिचुअल कोशेंट हला योर एबिलिटी टू सी योर फ्यूचर निजको निजर भविष्यत विषय रे सठिक ज्ञान दे परिवार बुद्धि नाउ दोस काइंड्स ऑफ थिंग्स इतरे ओएस विस्क स्टैनफोर्ड विने कैटल कल्चर फेयर गोटे कॉन्सेप्ट आछि कल्चर फेयर एंड कल्चर फ्री कल्चर फेयर मींस any kind of test which is relevant to मानकर गोटे इंटेलिजेंस टेस्ट से टेस्ट जदि आमे अमेरिका रे पिला को दबो से टेस्ट आम पिला को दबो then it may not be a working test तार वैलिडिटी लूज करि पारि लूज हे पारे कारण से मानकर कल्चर एंड ए अनुसार तांकर इंटेलिजेंस रो रेस्पॉन्स अलगा हमरो रेस्पॉन्स अलगा रहइबो सेति पई specifically culture fair test कराउची जे this test can be useful in particular relating to certain things intelligence test मन करा हम पिला मानक पे हमरो टेस्ट देबो तांको कल्चरल ये अनुसार से कल्चर फ्री कल्चर फेयर कांसेप्ट को टिके बुझिबो वेस्लर्स एडल्ट इंटेलिजेंस स्केल वेस्लर्स इंटेलिजेंस स्केल फॉर चिल्ड्रन एगुडा को पढिबो एई जगह रे एगुडा दरकार जेतु लिखिसंती कॉग्निटिव एबिलिटी टेस्ट उडकॉक जॉनसन टेस्ट कॉग्निटिव एबिलिटी पई एगुडा को हेतु तमर प्रैक्टिकल पई आसीबो देन सब गुडे टेस्ट इति वर्णना करा हिची एटीट्यूड स्केल लिकॉट थर्स्टोन पर्सनालिटी टेस्ट बुझी परछ ना नहीं तमर इछि अछि बेक्स डिप्रेशन इन्वेंटरी मु बोधे तुमको प्रैक्टिकल पढेबार अछि गोटे पेपर जो तरे एटा तमर अछि बेक्स डिप्रेशन इन्वेंटरी मु पढेबी कहिबी सेते बेले कोन बेक्स डिप्रेशन इन्वेंटरी तापरे रोसाक टेस्ट मु कहिछि रोसाक इंक ब्लड टेस्ट इज ए प्रोजेक्टिव टेस्ट if it is there I hope it may be there also in your practical ए जो टेस्ट गुडा गुरु केतटा तमर प्रैक्टिकल रे करिया को पड़िबो most possibly intelligence गोटे करिया को पड़िबो maybe you will be doing it ravens or ये with देखिबा प्रैक्टिकल कला बलकू से ये अनुसार डिसाइड करबा जे हमें को प्रैक्टिकल करबा तमे जानि छ कोन प्रैक्टिकल अछि तमरे पेपर रो anyway now तापरे स्पेसिफिक टेस्ट असला स्पेसिफिक क्लिनिकल कंडीशंस असला addiction assessment now society is in a grave of problems about addiction tame mane I hope all of you know understand the present condition of the society there is large scale addiction drug addiction alcohol addiction and even nowadays social addiction social media addiction addiction is a big issue and problem at present and assessment of addiction for their intervention treatment is a cry of the time बर्तमान समस्तंगर दरकार जे असेसमेंट केमिति हबो लेवल ऑफ असेसमेंट केमिति हबो कोन माने खाली तो एडिक्शन माने व्हाट इज द लेवल ऑफ कंजप्शन सेति तो नहीं बहुत प्रकार अल्कोहलिज्म पई विभिन्न प्रकार मनकर अछि असेसमेंट तांगर का ये and from that assessment intervention programs can be created for them for specific individual ये लोको ये अवस्था ये जिंसो या पे इंटरवेंशन ए भलिया ही परिबो so that he can be cured and come back to the normalcy of life those kind of things then addiction assessment is nowadays one of the most significant processes of assessment important requirement for assessment एवं तारा विभिन्न असेसमेंट प्रोग्राम्स अच्छी मेंटली इल सब सब्सटेंस यूज बहुत प्रकार वर्तमान लार्जली माने डिफरेंट काइंड्स ऑफ सब्सटेंस आर अवेलेबल and the younger generation is at risk serious risk ଆମେ ଦେଖୁଛୁ ଆଖ ପାଖ ଗାଁ ମାନେ ଲୋକାଲିଟିରେ ମଧ୍ୟ ପିଲାମାନେ କୋଉ ପ୍ରକାର ଅବସ୍ଥାକୁ ଗଲେଣି ଡ୍ୟୁ ଟୁ ଆଡିକ୍ସନ ସବୁ ମାନେ in many families the parents are in kind of difficulties ତେଣୁ ତାର କ୍ୟାରେକ୍ଟରିଷ୍ଟିକ୍ସ କଣ 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 ଅଛି ଏଗୁଡାକ ଦେଖିବେ ଯୋଉଗୁଡାକ ଅଲଗା ଇଏରେ ରହିଛି ଡେଭଲପମେଣ୍ଟାଲ ସ୍କିଲ୍ସ କାଇଣ୍ଡ ଅଫ ଥିଙ୍ଗସ ନାଉ ଦ ରେଫରାଲ ଆଚ୍ଛା ତମେ ମାନେ ଯଦି କିଛି ନ ପଚାରିବ ଆମେ କଣ କରିବା କିଛି ତାର ମାନେ have you gone through this materials ଆଗରୁ ପଢିଛ
Yes, sir.
Yes, sir.
ହଁ ପଢିଛ ଯଦି କିଛି ତ ତମେ ଇଣ୍ଟରାକ୍ଟ କରିବା ଦରକାର ନା ଇଣ୍ଟରାକ୍ଟ କରୁନ
Sir, my doubt is about referral question.
ଟିକେ ଟିକେ ମତେ ସୁବିଧା ଦରକାର କୋଶ୍ଚିନ୍ ହଁ କଣ
Sir, my doubt is about referral question. Referral question.
ଓହୋ ରେଫରାଲ କୋଶ୍ଚିନ୍ you are supposed to ask about ହଁ ରେଫରାଲ କୋଶ୍ଚିନ୍ ପଚାରିବ ତ
Yes, sir.
ହଉ ଠିକ ଅଛି ଆଉ ଆମେ ରେଫରାଲକୁ ଆସିଲେ କଣ ଆଚ୍ଛା now let us come to the referral part the assessment process begins with a referral of someone when you are in a position to assess means you are a professional and you are a popular professional somebody has recommended someone to you for his case ଏଇଟା ହେଲା ରେଫରାଲ ମୁଁ ଜଣକୁ ପଚାରିଲି ମୋର ଏମିତି ହଉଛି କାହାକୁ ଦେଖେଇବି ସେ ମତେ କହିଲେ ଏବଂ ମୁଁ ସେ ଅନୁସାରେ କଲି ବା ସୋର୍ସ ଖୋଜିଲି ନେଟରେ ଯୋଉ whatever may be referral means when you are recommended to somebody some institution some organization for your case that is what is referral and when you are referred to the first thing ତମକୁ ଜଣକୁ ଡାକ୍ତରଙ୍କୁ ପଠାଗଲା ପରେ ପ୍ରଥମ କାମ ହେଲା ଡାକ୍ତରଙ୍କର ତମର ଆସେସମେଣ୍ଟ ତମର କଣ ହେଇଛି ସେ ବିଷୟରେ ଶୁଣିଲା ପରେ he will recommend for certain kinds of tests if it is medical referral if it is psychological referral mental health referral clinical referral then ତମକୁ କିଛି ଟେଷ୍ଟ କରିବା ପାଇଁ କୁହାଯିବ now someone a parent a teacher a psychiatrist a judge or perhaps a psychologist poses a question about the patient why is John so the example ଦେଇକିରି କହିଛନ୍ତି टीचर कहले ये पिलाटा कहीं बहुत दुष्टामी करुछि ता बापांकु कहले ना ता बापा ता नेकिरी गोटे क्लिनिक की गईकिरी पचारे कहीं एते दुष्टामी करुछि why is John so disobedient सेठी then now it is a work of the referral हेगिरी आसला सेठी तापरे टेस्ट तार आरंभ हो तापरे आसला कोन हाँ कौन तमे what is the question that you want to ask
Sir, referral question. What is referral question?
what is referral question
Yes, sir.
how is factors that influence clinicians to referral question when somebody is referred to a doctor the doctor's referral question is about different test कौन से कहबे ब्लड टेस्ट यूरिन टेस्ट से अमुक ईसीजी से कौन ये जो सब विभिन्न प्रकार एमआरआई ए भलिया बट व्हेन इट कम्स टू a psychologist situation the referral question depends on what is the problem behavior being recorded or being reported by the client जे आसीची तार बिहेवियर कोन माने कोन प्रॉब्लम ता ऊपर डिपेंड करी करी जेतले बापा कहूची जे से डिसोबीडिएंट हेची से बहुत डिसोबीडिएंट हेची का कथा सुनुनी सेठी on the basis of that the referral questions will be created format ताकू कोन पचरा जिवो जो पिला बहुत खाऊची ताकू रेफरल क्वेश्चन जहाँ पचरा जीवो जे कथा मानुनी तापे समान क्वेश्चन नुही क्वेश्चन विल बी डिफरेंट एंड दोज क्वेश्चंस डिपेंड ऑन द फैक्टर्स कौन फैक्टर्स लिखला The kinds of information sought are often heavily influenced by the clinician's theoretical commitment. प्रथमे तमे जने लोक तम पाखु आसिला परे as a psychologist, as a clinical psychologist, you have some specific approach to your case. आमे जोटा कहूछु cognitive, supposing you are a cognitive behavior therapist or you are a psychodynamic therapist or जेमती डाक्तर गले तांको स्पेशलाइजेशन अनुसार से माने खोजिबे टेस्ट कौन करिवे सेमती जने माने क्लिनिकल ये पाखो गले इट डिपेंड्स ऑन द काइंड ऑफ पर्सन एंड हिज वे ऑफ ट्रीटमेंट सबु साइकोलॉजी बा क्लिनिकल साइकोलॉजिस्ट का अप्रोच समान बिहेवियर थेरेपी कॉग्निटिव बिहेवियर थेरेपी डिफरेंट अप्रोच अछि साइकोडायनामिक मु जो कहू तमे आगु जुडा पढिछ ताकू नै करी से माने तांकर रेस्पॉन्स रेफरल फॉर्मेट तैयारी करी जे साइकोडायनामिक अप्रोच से क्लिनिकल इन्वेस्टिगेशन पई माने मन कर मु तुमको या कहबी तमे जदी समान केस नै करी जने डाक्टर पाकू जीव आ जने होमियोपैथिक डाक्टर पाकू जीव तमरो पेट काटुची तमे डाक्टर पाकू गले डाक्टर माने जो प्रश्न पचारिबे होमियोपैथिक डाक्टर सही प्रश्न पचारिबे नी तमरो पेट काटुची से होमियोपैथिक डाक्टर पचारिबे तमे पिला दिने गछुरी पड़ी जाइथिलो की तमे बुझी परिबनी जे तांको प्रश्न रे या सहित कोन संपर्क अछि किंतु संपर्क अछि दैट इज देयर साइंस बुझी परछो ना रेफरल क्वेश्चन कोन
Yes, sir. Yes, sir.
रेफरल क्वेश्चन माने every counselor or psychologist or clinical psychologist they have some specific way of dealing with case जोटा कि हमें साधारण भाव में बिहेवियर थेरापी जने जदि केवल बिहेवियर थेरापी करूची तार अप्रोच से जो प्रश्न पचारिबो रेफरल रे जने साइकोडायनामिक थेरापी करूची बिहेवियर थेरापी इज कंसर्न विथ इमीडिएट प्रेजेंट वर्तमान कोन होची कोन नै पचारिबो साइकोडायनामिक थेरापी पाखो गले से तमरो पिला दिनर घटना पचारिबो पिला दिने कोन हेतला काहे ना दे बिलीव दैट थिंग्स आर देयर इन अनकॉन्शियस एंड इट इज मैनिफेस्टेड पिला दिनर कोन गोटे घटना वर्तमान रोग ही बाहरुची तनु से पिला दिन को जिबे कॉग्निटिव बिहेवियर थेरापी वाला बोले तांकर काम होला जे कोनसी जिनिस पई बुद्धि होची मूल सूत्र तनु तमरो माने बाहर करिवे तम भितर सेही प्रश्न अनुसार तनु दैट इज व्हाट इज द रेफरल माने सोर्सेस एवं वेरिएशंस इन रेफरल क्वेश्चंस किए कोन पचारिबो अच्छा now assessment in clinical psychology psychodynamics factors in बुझी पारलो रेफरल क्वेश्चन कोन
Yes, sir. Yes, I understood.
हां रेफरल माने जे जहा पाकू जाउछ ताकर स्पेशलाइजेशन एवं ताकर माने ये व्यू अनुसार से माने तुमको जो जो प्रश्न पचारि करी तुमठो उत्तर नेले बा जो टेस्ट करैले बा जो चाहिए कारण सेटा सब प्रकार रो माने डायग्नोस्टिक सिचुएशन पे समान नुहे किए कौन करूची सेति पे तुमको स्पेसिफिक लोकों को पाकू मध्ये जानती सेति पे जे ए लोकर एया मेथड से अनुसार माने रेफरेंस से अनुसार जाए ए लोक पाकू जाओ गला तापर आसिला कोन असेसमेंट इन क्लिनिकल साइकोलॉजी डिसाइडिंग ऑन थेरापी now another important aspect of this that when clinical investigations are made you have all the records about a person सबु जिनस तुम मिलला सबु ये आसीगला तुम जहा जहा असेसमेंट चाहितलो सबु पाइगलो नाउ द नेक्स्ट क्वेश्चन इज प्रेस्क्रिप्शन डाक्टर को पाखो होइतले ताकू स्टडी करी करी कोन हेची द डाक्टर तुमको प्रेस्क्रिप्शन दबो जे ए मेडिसिन इतिक मस खाओ ए मेडिसिन but when it is a case with a psychologist or clinical psychologist you have to plan a therapy program a therapy and how to program that therapy कौन बेसिस रे थेरापी प्लानिंग बा प्रोग्रामिंग हबो डिसाइडिंग ऑन थेरापी प्लानिंग प्रथम कौन प्लानिंग द थेरापी फॉर पेशेंट हु नीड एंड वांट टू रिसीव साइकोलॉजिकल ट्रीटमेंट involves deciding on the appropriate setting in which to deliver the treatment. Planning कौन हबो? Planning the therapy for patients who need and want to receive psychological treatment. Planning ता प्रथम हैला जहा को ट्रीटमेंट पाई तमे आसीची ता 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 विषय रे तार आवश्यकता विषय रे प्लान हो ताकू नहीं करी प्लान हो. Every individual, we say that every individual planning for therapy is different. It's same for not all individuals. Medical doctor तमर रिपोर्ट जदि समान आसला समान मेडिसिन देबे किंतु सेटा that is not that easy in psychological माने काउंसलिंग एंड थेरापी. मनकर पेट काटुची बोली डाक्टर पाक गले रिपोर्ट आसले समस्ते गोटे प्रकार रो मेडिसिन देबे किंतु काउंसलिंग बा क्लिनिकल सेटिंग रे द इंडिविजुअल हिमसेल्फ इज आल्सो ए पार्ट ऑफ द प्रोग्राम. तार बयस केते तार ये कोन तार एटीट्यूड कोन सेगुडा के सब आसीबो. Then deciding on appropriate setting in which to deliver the treatment. Now it is an important aspect of any kind of counseling and treatment therapy. कोठी तमे therapy दबो कोठी माने what will be the environment like. केही रहिबेनी तमरो थेरापी माने कोर्स रो एकदम से कोन single kind of approach common place है नथिबो. See, that is place is also an important aspect of a therapeutic program. तेणु गोटे सुविधाजनक जगह को जगह करा जीवो, that is the choice of the decision of the clinical psychologist. এই জায়গায় করিবে এই থেরাপিটা এই জায়গায় করিবে. Even মানে ये therapy can be done in a park. যদি জনে সেমতি প্র্যাকটিস করুছি সে কবে নাই তোমার এই কামটা তম আমগো এই পার্ক কো আসো we will be doing the therapy. That is also a kind of approach. তেণু place estimating the duration of the treatment. प्रथमरो गोटे भाबिबाक पड़िबो जे मु केतेटा सेशन नेबी गोटे सेशन रे केते समय मु काउंसलिंग करिबी बा थेरापी देबी. सपोजिंग मु आई टेक 1 hour सेशन कि 45 minute सेशन एवं एतिकी गैप रे मु 5टा सेशन देबी प्रति 15 दिन ने 20 दिन ने 5टा छाड़ी करी गोटे सेशन देबी. एंड what is the target of the first session pratham session ne kon karibi second, that is the planning of the kind of thing. And then selecting the particular type of treatment to be given. Now eta nishchay kon specific therapy dabo, behavior therapy dabo na cognitive behavior therapy dabo na khali cognitive therapy dabo na psychodynamic dabo ba any other na socio-cultural approach rakhibo therapy re kon seta bahut jinsa achi specialization kind of thing. सेगुड़ा तमे क्लिनिकल साइकोलॉजी रे पढिछ थेरापी ये सेगुड़ा कोन दबो दैट इज द डिसीजन. देन कंडक्टिंग थेरापी प्लान हैला तापर कामो केमती चाली हाउ इट विल गो ऑन. कंडक्टिंग ट्रीटमेंट टारगेट्स ऑन व्हाइल द थेरापी शुड बी फोकस्ड पॉसिबल ऑब्स्टैकल्स टू प्रोग्रेस टुवर्ड्स दीस ट्रीटमेंट गोल्स. आरंभ हैला one time session sorila, then there should be observation जे कौन progress करूछ. 5टा session हेलेनी किंतु progress किछि होउनी. Things are not happening better. The client is not feeling that he is going better, he or she is going better. Then that is what is the prognosis. से अनुसारे माने there will be change in the format. आवश्यक पड़ले change हबो, आवश्यक पड़ले ये करिवो. तेणु तापरे जदि चेंज होनी तो ये नीड टू स्टडी जे कोन पे चेंज होनी, ऑब्स्टैकल्स कोन अछि, कोन इश्यूज अछि जा फलर कि काम एटा काम करूनी. ऑल दोस काइंड ऑफ जेम जी डॉक्टर को जनी मेडिसिन ते खाइलो भलो काम कलानी तमे जे कला काम कलानी बिली से बदलौचंती. दैट इज आल्सो मोर इंपोर्टेंट इन केस ऑफ दिस. द प्रोग्रेस और प्रोग्नोसिस मस्ट बी चेक्ड. एंड तापरे इवैल्यूएटिंग थेरापी थेरापी हैला फाइनली अलॉटेड सेशन सरी गला एतिक दिन थेरापी हबो ट्रीटमेंट हबो चलीला सरी गला परे व्हाट इज द रिजल्ट. इज इट ऑल ओके ना इट इज 60% ओके. सेठी they have to go for these kind of things. Voila. Now instruments सब जहाँ अच्छी let us sum up. तापर असला unit 4 ethical issues in assessment. Now, whenever it comes to psychology, whenever it comes to treatment, clinical psychology, or any assessment, there are certain things which should be guided, which the professional should be guided about. Ethics is an important part of any job and profession, and it is more important in case of professionals who are dealing with human beings. ଯେତେବେଳେ ଜଣେ କାଉନସିଲର ଥେରାପିଷ୍ଟ ହବ, କାଉନସିଲର ହବ ବା ସେଇଭଳିଆ କାମ କିଛି କରିବ, ସେ କିଛି ଏଥିକାଲ ଗାଇଡାନ୍ସରେ ରହିବ। ଯଦି ସେଇ ଏଥିକାଲି ସେ ମିସ୍ କଲା, ଯେମିତି ଡକ୍ଟର୍ସ ଦେ ହାଭ୍ ସମ୍ ଏଥିକ୍ସ ଟୁ ଫଲୋ, ସେମିତି ସମସ୍ତଙ୍କର ଜବ୍ ଏଥିକ୍ସ ଅଛି, ଆଣ୍ଡ କ୍ଲିନିକାଲ ପ୍ରାକ୍ଟିସନର ମଧ୍ୟ ଜବ୍ ଏଥିକ୍ସ ଅଛି। କଣ କଣ ସେ ଏଥିକ୍ସ, କଣ ମିନିମମ୍ ଏଥିକ୍ସ? Now, ଏଇଠି ethics in assessment କଣ? ଏଇଠି ଉପରେ ଯାହା ଲେଖା ହେଇଛି ମୁଁ କହିଦଉଛି। mismatched validity. Mismatched validity means whenever you have got something about a client, in order to keep that client in your hand because he or she is paying, ତମେ ତାଙ୍କୁ ବହୁତ ମାନେ ଜିନିଷ କହିଲ, yes, things are there, I can take it, ମୁଁ ଭଲ କରିଦେଇ ପାରିବି, ମୁଁ ଏମିତି କରିଦେଇ ପାରିବି, ସେମିତି କରିଦେଇ ପାରିବି। You are making a larger validation of what you will be doing or what you are trying to do. ତମ କାମର କେତେ ସକ୍ସେସଫୁଲ ହବ ସେତିକି ନ କହିକିରି, ସେତିକି ତାକୁ ନ ଜଣେଇକିରି ତାକୁ ବହୁତ ବେଶୀ କହିଦବାଟା mismatched validity। ମାନେ ତାର ଯାହା ହେଇଛି ତମେ ଯଦି ମାନେ ମୁଁ କହୁନି ଯେ ନାଇଁ ତମେ ତାକୁ ମାନେ, but sometimes out of our own professional କଣ ଇଏ ମାନେ ପ୍ରଫେସନାଲିଜିମରେ ଆମେ ଜଣକୁ ଅଧିକ ଆଶା ଦେଇକିରି, ଯୋଉଟା naturally not true, we have to accept this is what you are, this can be done and this cannot be done. Those things have to be there. And then confirmation bias. Confirmation bias ହେଲା whenever you are being told by your client ତା problem ଯେତେବେଳେ ସେ କହୁଛି ବା ଗୋଟେ କିଛି କହୁଛି, ମୁଁ ଏଇଆ କଲି କଣ ହେଲା, ତମେ ତାକୁ ସବୁ ହଁ ହଁ ସେଟା ଠିକ ଅଛି, ଏଇଟା ଠିକ ଅଛି, without going deep into the issue you confirm bias। ବୁଝିପାରୁଛ ନା ନାଇଁ confirmation bias କଣ? Confirmation bias ମାନେ when you confirm things ଯେ ଏଇଟା ହଁ ଏଇଟା କାମ ଦବ, ଏଇଟା ଠିକ ଅଛି, ମାନେ over confirmatory without having critically analyzed thinking ଏଇଟା କଣ ଏଇଟା ନାହିଁ, ଖାଲି confirm, ସେଟାକୁ ଆମେ bias ବୋଲି କହୁଛୁ। ଯେକୌଣସି ଜାଗାରେ confirmation bias is not just a clinical term, it is a common term for anybody। confirmation bias ମାନେ ଆମକୁ ଯେ ଯାହା କହିଲା ହଁ, କଥା ନ ବୁଝିକିରି ହଁ ମାରିଦବା, that is confirmation bias। ଗଲା ତାପରେ confusing retrospective and predictive accuracy। ଆଗରୁ କଣ ହେଇଛି, ଆଗକୁ କଣ ହବ, ବୁଝିପାରୁଛ ନା ନାଇଁ? ଏଥିରେ ଯଦି କନଫ୍ୟୁଜନ ରହିଲା, କନଫ୍ୟୁଜ କରେଇଲ, ତମର ଏୟା ଆଗରୁ ଅଛି, ତମେ ଟ୍ରିଟମେଣ୍ଟ ହେଲେ ତମର ଏୟା ହେଇପାରିବ। ରିଟ୍ରୋସ୍ପେକ୍ଟିଭ and predictive accuracy, ତା ଭିତରେ କଣ ହେଇପାରିବ କଣ ନ ହେଇପାରିବ, those are the kinds of things। financial bias ପଢିବ, ବେଶୀ ଗୁଡେ କିଛି ନାହିଁ, ignoring the effects of low financial bias, ପଇସା ନବା ଏ କରିବା, unnecessary ଯେତିକି ଆବଶ୍ୟକ ତାଠୁ ଅଧିକା। mismatched validity, confirmatory bias, confusing retrospective and predictive adequacy, understanding standard test। ଆଉ ଗୋଟେ ହେଲା understanding standardized test। ତମେ ନିଜେ ଜାଣିନ ଏ ଟେଷ୍ଟ କଲେ କଣ ବାହାରିବ କଣ ହବ, ଟେଷ୍ଟ ଦେଇଦେଲ, you are not aware this test results କେମିତି ଇଣ୍ଟରପ୍ରିଟ ହବ। ମନେକର ଜଣେ ଦେଇଦେଲା TAT, but he doesn't know how to interpret, he or she doesn't know how to interpret the TAT score। କେମିତି ଇଣ୍ଟରପ୍ରିଟ କରିବାକୁ ପଡିବ, particularly with respect to with a person, TAT ତାର କଣ ଇଣ୍ଟରପ୍ରିଟେସନ ହବ, ସେଗୁଡାକ ଯଦି ନ ଜାଣିକିରି ଟେକ୍ନିକାଲି ସ୍କିଲ ନ ହେଇକିରି ଯଦି ଜଣେ ମନ ଇଚ୍ଛା ଟେଷ୍ଟ ୟୁଜ କରିକିରି ଏଡୁ ସେଡୁ କହିଲା, then that is understanding standard মানে বুঝিনি সে ignoring the effect of low base rates play a role in many testing problems but very low base rates seem particularly troublesome low base rate মানে there are certain things ଏତିକି ରହିବା ଦରକାର ଏତିକି ହେଲେ low base rate ରେ ଚଳିବ ଏଇ ଜିନିଷଟା ଯେମିତି ଆମେ ବ୍ଲଡ ଟେଷ୍ଟ ରେ ବାହାରୁଛି ସୁଗାର ଏତିକି 100 ରହିଲେ ନର୍ମାଲ ଯଦି ସେଇଟାକୁ ଲୋ ବେସ୍ ରେଟ୍ ଟାକୁ ଇଗ୍ନୋର କରିକି ଜଣେ କଣ ସାଇକୋଲୋଜିକାଲ ଟେଷ୍ଟରେ ମଧ୍ୟ ସବୁଥରେ ଗୋଟେ ନର୍ମାଲ ରେଟ୍ ମଧ୍ୟ ଅଛି ଦିସ୍ ଇଜ ହ୍ୱାଟ ଇଜ ଏ ନର୍ମାଲ କଣ୍ଡିସନ ମନେକର ଇମୋସନାଲ ଇଣ୍ଟେଲିଜେନ୍ସ ତମେ ଟେଷ୍ଟ କଲ ସେଲ୍ଫ ଆୱାରନେସ୍ ଯଦି 50 ତଳକୁ ଗଲା ତାହେଲେ ତମକୁ ଭାବିବ ଯେ ତମର ଟିକେ ସେଲ୍ଫିସ୍ ମାନେ ସେଲ୍ଫ ଆୱାରନେସ୍ କମ ଅଛି ମାନେ ୟୁ ଆର ସପୋଜ ଟୁ ଷ୍ଟଡି କିନ୍ତୁ 60 ଉପରକୁ ଡେଇଁଗଲେ ୟୁ ଆର ନର୍ମାଲ କାହାର 80 ରହିଗଲା ବୋଲି ଯେ ତମର 80 ରହିବ ସେ କଥା ନାହିଁ এই টাইপের জিনিস মিসইন্টারপ্রেটিং ডুয়াল হাই বেস রেট পারফেক্ট গলা ফিনান্সিয়াল বায়াস পয়সা পত্র অনসার্টেনিটি গেট কিপিং অনসার্টেন গেট কিপিং এপিএ এথিক্স কোড এপিএ হলা আমেরিকান সাইকোলজিক্যাল অ্যাসোসিয়েশন তার হলা এটা এথিক্স কোড এথিক্যাল প্রিন্সিপলস কোন রেসপেক্ট ফর পিপলস রাইট এন্ড ডিগনিটি এটা আমি খালি এপিএ জিনিসটা কই দউছি দিস ইজ ইম্পর্টেন্ট एपीए रो एथिक्स कोड हला कॉम्पिटेंस तमे जदी कॉम्पिटेंट नुह तमे जदी ठीक जानि न तमे जदी सठिक एड्रेस करि परिबो नै प्रॉब्लम लोकंकर देन यू डोंट एड्रेस डोंट डिक्लेयर योरसेल्फ एज ए प्रोफेशनल डोंट टेक पीपल फॉर योर प्रोफेशनल ये लोकन को जमा भूताओनी जदी न तमे कॉम्पिटेंट नुह को नै मु जाननी मु करि परिबि नै कथा अन्य मानु जे कॉम्पिटेंट ताकू रेफर करो बा निजे ये करो गला सेकंड इंटीग्रिटी इट हाउ इंपोर्टेंट एथिक्स एक्चुअली इंटीग्रिटी माने यू बी ट्रू टू योर प्रोफेशन इन ऑल रेस्पेक्ट आज जनकर असुविधा पड़ी ताको 10,000 टका देले मु तुम केस देखिबी नो if you are charge is 2,000 take 2,000 from anybody and everybody टेस्ट न करी ठीक रे कहा हे गला जाओ मु देखि देबी नो दैट इज व्हाट इज इंटीग्रिटी प्रोफेशनल इंटीग्रिटी मेंटेन करिया पड़िबो प्रोफेशनल एंड साइंटिफिक रिस्पांसिबिलिटी मींस you have to say I am administering this test and this test has both high reliability and validity. This is a very common, popular and mostly used professional test. समस्त याको व्यवहार करछंती यार रिजल्ट बहुत तार साइंटिफिक स्टेटस जानिबा दरकार कोठो आसुची के करिची तार कोन साइंटिफिक स्टेटस जे प्रोफेशनल से ता सहित माने रिसर्च सहित टच रही कि से जानिबा दरकार साइंटिफिक सेते बेले जाई कि करि परिबो नले मन इच्छा जामनता कर दे परिबोनी देन रेस्पेक्ट फॉर पीपल्स राइट एंड डिग्निटी नाउ एवरी ह्यूमन बीइंग is a worth and is a respectful person in the society से जे ही था सबु मनकर उठे सबु ह्यूमन एवरी ह्यूमन बीइंग हैज ए डिग्निटी उठे रेस्पेक्ट अछि समस्तंकर का कुछ छेछा करी के जा काई पे पोइछ पळा दाउडो your behavior should be polite and respectable to anybody and everybody whosoever it may be कि माने बड़ लोकटे पळे आसले ताको एकदम ये व्यवहार केति पळे सेही दैट इज व्हाट इज डिग्निटी राइट्स एंड डिग्निटी देन कंसर्न फॉर वेलफेयर naturally you are not just there for to earn your money तमे पैसा रोजगार पे खाली बसिनो you must do it in such a way that it becomes a welfare of the community and society समस्तंगर किछि भलो करूचो से मानसिकता मन भीतर रहबा दरकार है then social responsibility you are a part of the society you have to do certain things for the society you have to contribute to the society is beyond you you are in the society or under the society that feeling that thing must be there किसी जिनस अच्छी इनफॉर्म्ड कंसेंट मु कहि दउची इनफॉर्म्ड कंसेंट मींस मु तुमको नेइकरी तुम विषय रे जहा करिवार अछि मु तुमको से विषय रे जणैबी ये टेस्ट देले तमरो पर्सनल लाइफ रो एई जिंस आसीबो बाहर को मु तुमको जणेबी जे तमरो पर्सनल लाइफ विषय आसिले तमे राजी की मु तमरो पर्सनल लाइफ विषय जानिबा आवश्यकता जानिली बोली किबा कोन टेस्ट देली इंक ब्लड टेस्ट देली तमरो एई जिंस बाहरिबार संभावना आछि ए विषय मते जणेबा पे तमे राजी की दैट इज इनफॉर्म्ड कंसेंट तमे कंसेंट दबो फॉर्म रे जे यस आई एम विलिंग टू शेयर देन पढ़िबो confidentiality important ethics confidential means whatever I come to know about you I am not supposed to share it with anybody else तम विषय रे मु जहा जानिली मो विषय रे तम विषय रे मते जहा जणैलो टेस्ट हो कथा इंटरव्यू हो प्रश्न पचारिबार हो जहा जणैलो केवल तम मो भीतर कथा सेटा केही जानिबे नाही दैट इज confidentiality and finally invasion of a privacy at no circumstances no doctor no therapist can invade the privacy of any client privacy अछि से privacy की प्रवेश करिवार अधिकार मोटे नाही that is unethical and now it is over हला तमर पिलांक संख्या आस्ते आस्ते कमी जाउची तने आउ किछि नाही any question anybody or else we'll close the class
Sir, can you provide some questions from the fourth chapter, 4 units?
question for this chapter
For
माने
this 4 units.
नहीं क्वेश्चन माने कौन कोथि पे फॉर योर एग्जामिनेशन
Sir, examination.
हाँ सेटा मु गोटे काम करूची मु सबु चारिटा को यूनिट पढ़े देला परे लास्ट क्लास रे मु तुमको केतेटा इंपोर्टेंट क्वेश्चन से विषय रे दे दे
Okay, sir. Thank you.
इट्स नॉट दैट दोस आर ओनली इंपोर्टेंट क्वेश्चंस तमर तो असेसमेंट पे आथिबो
Sir,
असेसमेंट को नहीं आते रे
sir, जो
ये पेपर असेस एनीवे आमे मु चारिटा को पढ़ी सरला परे इन द लास्ट क्लास मु सबु चारिटा को यूनिट रो क्वेश्चन दे दे डिस्कस
I
कर
guess.
हला
I guess.
हाउ एनीथिंग एल्स ना बंद कर दो ओवर
सर सब दिन 2टा बेल को क्लास हबो कि
हम मो क्लास गुडा को 2टा रु रहिबो काहे ना मोर 5टा रु आ गोटे क्लास रहउची अलगा जागा रे
आगे सर
काई कोन असुविधा कि तमर 2टा बेले
नहीं सर क्वेश्चन करतली
हां माने
2टा
असुविधा नहीं तो नहीं से माने अलगा टाइम दउथले मु किंतु 2टा मोते कन्वीनियंट हबनी अलगा टाइम और क्लास रहउची अदरवाइज माने इवन या पूर्व मध्य मु क्लास नहीं करी आसीची 10टा रु 12:30 एई टाइम ला मोर गैप थिला म तम कहिची करी करी एई टाइम रे जदी मत देबे म नहीं परिबी न हले नाही नहीं तमे जदी इफ इट इज नॉट कन्वीनियंट फॉर ऑल ऑफ यू कैन आस्क देम टू चेंज द क्लास एंड गिव इट टू समबडी एल्स
नहीं सर किसी नहीं ओके
हां से हम पछतु रखली
I guess.
थैंक यू सर
हां
Thank you.
थैंक यू
सर नमस्कार सर
नमस्कार हां को मु तुमको देखुची जे कोन कहि कोन कहू
ना ना सर किसी नहीं सर
नहीं मु एबे देखिली मु एक्चुअली से ये तो माने स्क्रीन शेयर करथिल तो स्क्रीन ता देखा
आगे, आगे,
करथला
सर
गांटा आस्थला मजे देखिची
आगे।
तेणु एया मु मोर 2टा बेले न नेले मते माने आ समय नाही
ना सर ठीक है सर किछ असुविधा नहीं
हां ठीक है रखली
आगे सर नमस्कार सर
नमस्कार